Well, hello and welcome to Rajat TV. You're watching India Fights Back with me, Rajat Kain. Well, the government has allocated 35,000 crore for coronavirus vaccines in country as part of newly launched Atma Nirbhar Swasth Bharat Yojana in its fight against COVID-19 pandemic. With an increase of 137% provided from the budget outlay for health and well-being, the government aims to strengthen nutritional content delivery, outreach and outcome. The Supplementary Nutrition Programme and Poshan Abhiyan will be merged and Mission Poshan 2.0 will be launched to improve nutritional outcomes across the country. So how important is it to have an increased outlay on the health infrastructure as percentage of the GDP? Remember, we're talking of the country which in last 1 year has fought this COVID-19 pandemic. And of course, just few weeks ago, precisely last fortnight, India rolled out what is already been built as one of the largest mass immunization program. So, to discuss further on this issue, we joined with a panel of three important guests. Dr. Rana A.K. Singh, he's Medical Superintendent and Director, RML Hospital. Many thanks, Dr. Rana, to be part of the show. Urmi Goswami, Assistant Editor, Economic Times. Many thanks, Urmi Goswami and Dr. R.K. Srivastava. Many thanks, sir. Former Director General, Health Services. Let me start with you, Dr. Srivastava. The increased spending, or to say the increased budgetary outlay on the health infrastructure, how important do you see? I know it's a year, last year precisely, we have seen a huge, gigantic pandemic, and now we are at the stage of fighting this pandemic with an indigenous vaccine. So how important is it to have an increased outlay on the health services? Sir.
I think, Rajat, you have highlighted the most important issue, health being a social sector and one of the very important sector. And simultaneously, I will also say that one of the sector which has not been properly invested by the government has seen a light after this pandemic of corona, when in this budget there was a real concern shown in terms of monetary allocation to the health. Now this 137% outlay which is being proposed is looking health at from the point of view of all the aspects. It is not only patient going to the doctor and getting consultation. It is public health also. It is also all those contributory factors like air pollution, like water pollution, and it is also all those response mechanisms which has been deficient in the public health system, like the critical care facilities, like the various type of lab facilities which need to be there to tackle these type of public health menace, like the various type of institution which has been needed in past, like one health institute which has been proposed, I think one of the most important institution which will cut across all the ministries and try to converge their activities towards one health, a very important initiation towards promotion of the health, prevention of the health, like Swachh Bharat and Swasth Bharat Yojana. Now all these things have been spoken at length by the Honorable Finance Minister when she talked about this budget. Now the question is how best we can work out to convert this allocation into spending. And spending does not mean consume money.
Yes.
Spending means consume money for the right person, for the right institution, so that the outcome is achieved. And the outcome which we are envisaging as professional, as manager of the health sector is two: a strong, robust public health system, including vaccine production and vaccination program, which can respond to pandemic situation like this. And a very important convergence of all the programs which are directly or indirectly converging towards and helping the health. So one health and all these things I foresee it as a very important challenge for the state government, very important challenge for the central government, so that they can ensure that the spending is proportionate to the allocation and in the right way.
Right, sir. Right, sir. So many thanks for your opening remarks. Let me go off to Urmi Goswami. Urmi, many thanks for joining us in the show. I know, this budget where we saw an increased push on the infrastructure and the sectors like social, health, and other indicators. Now, how important do you see this spending is on the health sector vis-a-vis what has been our spending or outlay on the health sector as a percentage of GDP if we compare it in the past?
So if you look at the spending as a percentage of GDP, it's I won't say there's a quantum leap. I think it now comes to about the budget estimate for this coming year, that's 21-22, is about 1.8% of that's central the union budget's expenditure on health. And by health, I mean not just the expenditure as an allocated to the line ministry, that's health and family welfare ministry, but health as a concept, health and well-being. So it looks at it in a more systems perspective. So one could argue that, this jump, there's not a quantum jump. There's a quantum jump in terms of percentage, but not as a share of GDP. But what is important is to remember two things. One is this is a country with a fair bit of financial constraints. If you think about our tax to GDP ratio, it's about 17%, and that is the pre-COVID amount. This year, the tax revenue, the government is targeting at 10% for the union. Now, that's roughly, if you add up with the state taxes, it will come to roughly again 16.5 to 17% of the GDP. So basically, we are functioning in a level of financial constraint. Now, within that constraint, how do you best use your money? So what is important is how you use your money in that case. When you have little of it, you have to show your smarts in the way you use it. And this budget actually shows us that. And that is what makes the allocation for health so interesting, because you're taking a systems approach. As Dr. Srivastava mentioned, you're talking about building capacity. 64,000 crores and a little more, actually. I'm just giving you 64,180 crores is what you're using for capacity building, both in the urban and rural areas. There are several rubrics in which the expenditure is happening. What are you doing in that? You're looking not only at health as in cure, but you're looking at health as in prevention. One of the things that we need to remember about India's tackling of COVID is a lot of things got done on prevention. You took timely steps to ensure that your exposure was limited. And that is critical in a country of the size of India, with a population, not only in terms of population and area, but also in terms of the socio-economic spread of the country and the nature of our healthcare. This 64,000 crore that has been allocated for the next 6 years will see capacity building. But we are not going to see that capacity being built overnight. It's a work in progress. So therefore, you have to keep doubling down on prevention, and which is where the wellness part of the story comes in. So to go back to what you asked is, how critical is this renewed emphasis on health? Look, there was no way that you're coming to a post-COVID budget and you're not talking about health, because that's the one big thing on your mind.
Yes.
But how it is that you design that health, the idea of health, and that is where this budget has been interesting. It looks at health not just as what the Ministry of Health and Family Welfare does, but also other allied areas which comprise health. So water. These are all line ministries that are different from the health and family welfare, but they all contribute to health and well-being. There is more that can be done, and obviously that requires more money, more push.
We will come to that.
But you need the capacity.
We will come to that, ma'am. Let me just have opening remarks from each three of you. Dr. Rana Singh is also with us. He is medical superintendent, and he is fairly, recurrent in the show, and time and again he has spoken about like how a fight against this pandemic has been. Dr. Rana, let me just pick your thought on that. Like starting, I mean, I know just like last week we completed one long year of fight against COVID-19 in terms of say the infrastructure, the institutional infrastructure of health, how difficult this fight has been against COVID-19.
I think if we look at it in a holistic manner, and if we compare this catastrophic disease, its effect on the mightiest and richest of the country in the world and on us, it is very satisfying. I am telling you, it is very satisfying that it did not, inflict as much catastrophe to us as much it did to the mightiest and the richest countries. Why? I mean, the answer to this question which comes to my mind is timely thinking about that when it has already affected the other part of the world and it is so menacing. So timely decision was taken at the highest level, if I may say, at the level of the Honorable Prime Minister, that we must do everything to contain this disease. Of course, in the whole process, there is a saying, there is no gain without pain. I mean, the difficulties has to be faced by one and all. But the overall, if we look at the whole thing as on a global scenario, we are on everything. If we talk about the percentage of death, the number of people whom we have saved, in spite of the constraints we just were talking about, that like hospitals, bigger institutions, they are concentrated in metropolitan cities. The health infrastructure is not as effective if we travel to the peripheral part of the country. But if you look at it holistically, we had a very good outcome as far as the management of this corona catastrophe is concerned. And now coming back to this budget emphasis has been given that the allocated money or allocated budget will not only be used like for one particular group, one particular area. They have focused on the improvement on the infrastructure of the primary healthcare centers, to the secondary healthcare center, and to the tertiary healthcare centers. They are augmenting the bigger institutions, and also they are aimed at opening up bigger institutions. So it's a holistic approach for on a national scenario, that let us be Atma is that we should have the infrastructure, manpower, trained manpower, everything in place, so that we can save as many our like people as we can. So it's a very holistic approach.
Okay. Right. Right, Dr. A.K. Singh, I'll come back to you. Urmi, you were just suggesting in your reply that perhaps more should be, or for that matter, we should look ahead and plan more in terms of achieving what we can with this outlay. Please continue. I'm sorry, I had stopped you in between, but I had to include Dr. A.K. Singh and have his opinion before we broad base this discussion. Yes, Ms. Goswami, please.
If you noticed one thing when you hear Dr. Srivastava and you hear Dr. Singh, is they're both talking in terms as practitioners, as people who have been associated, as people who are partly in the practice and the administration of health, they're talking in terms of holistic, where you're looking at the full range of these the spectrum of healthcare. Now, and both will agree that when you're looking at the whole spectrum of healthcare, you need to take a step back, which Dr. Singh again mentioned about how timely steps were taken. Now, we have to focus a fair bit on prevention, which is where the question of wellness comes in. Now, what does that actually mean? There are very new age ways of looking at it, but in a very simple terms, we are looking about making those conditions possible which prevent the recurrence of such diseases. Now you have to remember that pandemics like this are not. This is not a once in a. I mean, this has happened. This is a once in 100 years pandemic. But you have had many smaller pandemics that have happened. You had Ebola. You had SARS. So that is where the issues of health, of course, but sanitation, better drinking water, better nutrition come in, and I think that is again a big focus in this budget. And I think that's where we should also be concentrating as we are building up capacity. You have to remember that one of the biggest problems in our healthcare system is the absence of capacity. Both Dr. Singh and Dr. Srivastava mentioned about how if you go away from the cities, then there is a lack of proper healthcare facilities. The other area that perhaps we should be looking at for the future is also investing in understanding traditional medicine. I know it's all lumped in and either called traditional medicine or Unani or Ayush, but basically these are also lines of medical a learning that we should focus on to give a more scientific basis to that. I mean, you have world over people talking in terms of using bio resources to create medicines. Like, I mean, to give a very simple example, everybody now talks about using turmeric. Whether you're in India or you're in the United States, people talk about the medicinal value of turmeric. Now, can we have a more scientific basis to that and build that into our system? Because you need to broaden your sort of spectrum of what medicine is. So those are areas I think. So R&D, whether it's traditional medicine or vaccines or our modern pharma, we have to invest more there as well.
Right, Ms. Goswami. Just stay on with us. Dr. R.K. Srivastava, just 35,000 crore has been allocated for the COVID vaccine alone. I know it's a gigantic operation. In terms of using this crisis as an opportunity, as in your opening remarks, you mentioned that how we are moving towards a self-reliance. So how important this indicator, having an indigenous vaccine, is for India? And is it by far the largest mass immunization program that we'd seen in our lifetimes?
I think the investment which has been earmarked in the present budget for COVID vaccine will ultimately translate into infrastructural built-up in the manufacturing sector, which will keep ready to convert a candidate vaccine into a vaccine which is for any type of pandemic. Say, this infrastructure, like they have already created in US and Germany, these type of infrastructure there. So this investment is going to form the infrastructural strengthening for building up vaccines for rapid response. We have seen vaccine is not only meant to control the pandemic. Vaccine is a very important item to showcase the worthiness of a nation of the size of India world over. It is a diplomacy type of channel also. So vaccine productions was invested with this money, and our vaccine productions manufacturing sector, which I have seen them, this has very, very strong scientific basis in the country, and they have built it up. So this investment is going to provide a jumping pad. The second thing is that when we are talking about the vaccine and the utility of the vaccines and the present program of mass vaccination, simply on account of the size of the country, this vaccination program is going to be, as far as the numbers are concerned, one of the largest program globally because of the time frame in which it is being implemented and the type of scale on which it is being implemented and the type of monitoring and evaluation mechanism, surveillance mechanism which has been put up for a vaccine which has been granted permission after approximately efficacy trial and safety trial of the data, which is of 3, 4, 5 months old. Now, this vaccine is definitely, when being tried on such a mass, such a big, huge population, all these things, its preparations, its operation, its surveillance, and its outcome assessment puts this immunization program for the COVID-19 as the largest immunization program which any country over the world has taken up till this time.
Right. That's very important, Dr. Srivastav. Dr. Rana Singh, sir, we've been discussing about our mass immunization program in this, especially in our program IFB. This is one program which is all about India's fight against COVID-19 pandemic. Now, it's when you talk of the vaccination, it's not just the expenditure on the medicine alone, but there are supplementary activities. They are related infrastructure. So this allocation in the health, well-being, and primarily to vaccine for COVID-19, how this expenditure, how this revenue inflow will help in terms of other supplementary activities which are related to vaccination?
See, this the investment which has been planned to be made on not only on the vaccine but on the whole of the like that on the health infrastructure and everything. If we look at the vaccine as such, vaccine is to give protection against particular disease. In this it is corona. Prevention is better than cure. I mean, we were taught when we were, like medical school, that it is better to call, to stamp the spark than to call fire brigade. So, in the opening remark, Dr. Srivastava had said that a lot of emphasis has been given on the nutritional supplement. What the nutritional supplement? How are they going to help? If you have got, if your nutrition is good, your body is good, fit, that gives you, like protection against any disease. So same way the vaccine. If you are vaccinated, you don't get this disease. So then you are productive. The whole thing is aimed at making India into a healthy nation. A healthy nation is a wealthy nation.
Absolutely.
So if you look at the investment and and when we achieve and when the achievement is made in terms of the overall health scenario of the people of this country, you will find that the return will be how many times more than the investment. That will be unimaginable, because the biggest asset of a nation is what? A healthy citizen. So a healthy citizen, that translates into wealth. Like, I'm working. I earn my salary for my family and everything. So the whole aim of making Atma Nirbhar Swasth Bharat is a wonderful idea. And when we're talking about investment in the COVID vaccine, when I was thinking about it, I was thinking that our honorable Prime Minister has acted like a true Indian. What do I mean? True Indian concept is Vasudhaiva Kutumbakam. The whole world is yours. So he has not only aimed at vaccinating and protecting our own populace. He has sent the vaccines to our neighbors.
Right.
And why only neighbors? To far-flung areas of the globe. And why? Because he wants to, for him, the life of this citizen of other country is as much important as the life of his own citizens. So, his aim, his sentiment. If you close your eyes and perceive it, you will be amazed that how
Dr. Singh.
far he has gone and thought about everything.
Right, Dr. Rana Singh. Many thanks. And as you said, a healthy nation is a wealthy nation. So we sign off on that note. This is a show primarily on COVID-19. Of course, we discussed the utilities of, for that matter, the importance of an increased outlay on health infrastructure. Well, many thanks for joining us, Dr. Rana Singh, Urmi Goswami and Dr. R.K. Srivastav. But as we emphasize in this show, please listen to experts. Our fight against COVID-19 is still on. So here is a small advisory by RSTV to all our viewers. Well, keep wearing a face mask, keep washing your hands, and do not forget to maintain physical distancing. Remember, these are small things that can help us in defeating this pandemic. Well, that's it in this edition of India Fights Back. Keep watching RSTV for more. Thank you and goodbye.